Now on the situation on the ground in Gaza, we're joined next by Dr. Ammar Ghanem. He is a physician in Detroit and with the Syrian American Medical Society, currently volunteering in an ICU in Gaza. Dr. Ghanem, we thank you so much for joining us. Describe the scene where you're working and what you and other doctors are enduring right now.
Thank you for having me. I have been on multiple missions before, but what I have seen in Gaza and the hospital here and the ICU, I've never experienced before. It's really something like above what you can describe unless you see it in your eyes. I mean, there is multiple things I can, mention here, but mainly, I mean, we talk about injuries that they are very complex and severe. Mainly, I mean, like trauma-related and some neurotrauma that's, as you know, is very hard to deal with, even in advanced healthcare like the U.S. and Europe. It takes a village to take care of one neurotrauma. On the top of this, there is a lot of shortage when it comes to medical supplies, and then also for staff. The staff shortage is the biggest struggle that we go through since I came here for the last week or so. I can see that shortage affecting medical care in a big way. And on the last 2 days specifically, since the escalation happened around us here, and we can see more shortage happening because, for example, today I went to the ICU. It's the hospital actually is a tertiary center. This is the only hospital still functioning in South Gaza. And I was expecting, the staff to be there, but I mean, for physicians, they were supposed to be covering the ICU. They were not able to be there because they have to take care of their families. Their families' safety goes first, so they couldn't show up to the hospital because of that reason. The same applies to nurses. Multiple nurses, they could not come because of the same reason.
I know you mentioned that there are medical shortages. What are the most urgent medical needs, would you say, right now for patients?
Well, I mean, to be honest with you, is really when you have, I mean, you work on the ICU, you have to have everything to take care of these sick patients. You have to have, ventilators, you have to have other equipment, dialysis machines, you have to have supplies that you intubate the patient in case they need it. You have to have the medication to support their blood pressure, sedation in case you put them on the ventilator, and so on. I've never been through experience that I have to prioritize patient lives over other, like kind of a triaging and like, dropping some patients. It's really heartbreaking, but we have to go through this because we know some patients, they have a very poor prognosis and they suck all of your resources. So you have to, prioritize other patient lives that they still have a hope with, younger, and you be able to do, something and save their lives compared to other patients. I have went through this experience with multiple patients, and I felt very, very sad from inside for doing this.
We understand the border where you entered Gaza is now closed and that the situation has escalated since Israel took control of the Rafah crossing. What does that mean for you and other Americans who are trapped there? Do you have any idea how you'll get out?
I don't, that's when we came in, we have the promise, okay, you go in and you come out in this, time. WHO is trying to organize and coordinate all missions. Not only us, under SAMS, there is a PAMA, which I joined, on the mission, which is Palestinian American Medical Society. And then you have other organizations, including FAJR and other groups. And you have other United Nations, AID, and Red Cross. And all of these people are trapped here after the border is closed. So we don't know what's going to happen next. We are concerned about our safety, and then we want, to see what's the solution. We are in daily communication with WHO and the coordinating body, but still we don't have promises. For example, they said maybe yesterday it did not happen. Today it did not happen. I don't know what's going to happen about tomorrow.
Dr. Ammar Ghanem, we thank you so much for your time. Really appreciate your insight.